Welcome back to Dr. Isaac's dental office. This week we're going to tackle fillings. It's probably the most common type of procedure we do here in the office. And we thought we'd kind of go over the two types of fillings we use, either amalgam, metal, or a composite or a plastic-based resin. We do more of those probably than anything in our office, and it's probably the most common thing everybody gets done with a dentist. So we thought we'd go over the two types, why we use the metal versus the plastic, what are the indicators to use one or the other, and then we'll give you a demonstration of exactly what's going on inside your mouth when we're actually putting those fillings in, so you have a better understanding of what we're doing since you're not able to kind of see what we're seeing. So hopefully this will be informative. Hopefully it'll give you a little bit more knowledge into why we do what we do in different situations. I've got Dr. Isaacs here with me today. First, we want to cover the two types of fillings, like I was talking about, an amalgam or metal, or the compositor, which is a plastic filling. And we've got an X-ray up here.
This, Scott, if I can just kind of demonstrate, this particular patient has, the reason why we chose this X-ray, this patient has both of the two fillings, two primary fillings that we do. We have a plastic filling, which is a composite resin filling here, and this is the metal or the amalgam filling in the back. And most people, when they come in here, we get a lot of people that actually request. Of course, everybody wants a tooth-colored filling, and we do those. We do them routinely. And when do we do them? Well, we do them when aesthetics are going to be a problem, when we can see it, and also if the filling is going to be large, if it's going to be what we consider a too large. The decay is not a large amount of decay, because if you put a white plastic filling in there, it has to have a small amount of decay. If you have a large amount of decay, then you want to put the stronger filling, which would be the metal filling. And this is a tooth number 13 on a patient, and on the front end, this is her smile. Her face will be out this way, so when she smiles, you can see this little part. So we put this filling in with the composite, the white filling. This one, we put this one in with the metal, or the silver filling, and it's kind of a hybrid. So she's got the best of both. She can, when she smiles, you don't see it, but she has the strength of a filling here. And as Scott was saying, we do many of these today. We do anywhere from 10 to 20 to 30 fillings a day. So we do several of these throughout the day. And this patient, as you can see here again, this is a metal filling here in the molar, and back here where it was smaller, we put in the white or the composite filling. So and next, Scott is learning to be an ADA, which is expanded duty dental assistant. In order to do that, you have to go to the university and get trained. Right now, he's going to the University of Louisville and taking classes, and he's going there tomorrow morning, I think. And we thought this would be a good time to, well, it's really fresh on him, and he had homework to do. I said, why don't we do it on air, and that way we can go ahead and show you some of your handiwork here on air. So Scott, why don't you go ahead and show what you're going to be doing.
Yeah, and before I get to that, I want to just cover one more thing. Like Doc was saying, we'll use those white fillings for aesthetic purposes when it's going to be visible inside your mouth. The other thing that comes into play here, and correct me, Doc, is on those back teeth. We have a lot of people who come in, their molars, the teeth all the way in the back, they're like, but I want white fillings. We can do that, but it becomes a structure question. Is it small enough to where that plastic or that composite filling will hold up over time with all the chewing and the abuse our back teeth take? Or is it large enough that the doctor feels that it needs to be that metal filling in order to hold up over years of the abuse that we put our back teeth
right.
through?
The answer is, can you put in white fillings? The answer is yes, you can.
Right.
You can put it in anywhere, but it won't last. You just won't. We found that it just we don't get the longevity out of the filling that we want. And we don't want to do these every 6 months. You don't want to have to redo them, and that's why we would try to talk to you. But we'll do it, and we can if the composites don't work, then we can always put a crown or something else aesthetic.
Right, and conversely, on your front teeth, or what we lovingly refer to as your smilers, we will have folks come in that have just so much decay that even on those front teeth where they're visible, we will go ahead and actually put a metal filling in there instead of the white kind. And again, That's for structure and support.
If the lip line is such that you can do that, or you can hide it, and then we'll come back and put a crown on it at some subsequent appointment, so that we will bury that. But yeah, it's tried and true for longevity. That's what we like to do.
So there's no hard and fast rules on what type of filling we need to use where. There are guidelines, and it just depends on how severe the case is and how aggressive the doctor feels he needs to be with that filling. So today what we're going to do is we're going to actually demonstrate one of those white or composite fillings, the plastic resin fillings. I've got, from my class here, I've got my upper jaw. It would sit in your mouth like that. I've taken it apart so I could show you a little better. So we're going to set that there, and you'll notice we're always putting different things in your mouth. So this is actually called the Tapa Meyer. It's basically just a clip with a metal band. When your teeth come together, we want to make sure you can get your floss in there, but we want to make sure that there's a limited amount of space so when you're chewing, you're not getting food packed in there every time you chew. So we use these bands to keep the teeth separated so we don't join them together, and we get a good contact from one tooth to the other. So this is a way of kind of protecting, making sure you're still able to floss and keep up your good hygiene, but then also allowing that contact to stay tight and good so you're not packing food in there as well.
And as you can see, Scott is turning this, and as he's doing it, he's actually pushing a little bit on the gum. That's why we do use anesthetic to do these, put a filling in there. Number one, we do it because whenever we prep the tooth, when we use a handpiece or what the layperson would call a drill, we have to remove the tooth structure. Here, we're just pushing the metal piece around the gum, and that's what we use anesthetic.
You can see right here in the front, hopefully, that we're above the gum line on the side, but between the teeth, we've actually pushed that metal band down into your gum to make sure that we maintain a good tooth structure and a good contact between the two teeth. The next thing we'll do is very old school, but it works the best. A plain old
wooden wedge.
Now what we'll do is we'll go in here once we've got the band in place. We'll put that wedge in place and just push it in real far.
Teeth are not locked in the bone, they're in ligaments. So whenever you put a wooden wedge in there, you actually separate them out a little bit. And when he puts the wedge in there, it's pushing against the ligament and allowing space to come in there. And then when he puts the filling in there, that's okay, one will work. And then when he puts the filling in there, you take the wooden wedge out, and the ligament will rebound and close the gap down. And then you can go ahead and contour as needed.
So just hopefully you can see that we've got the wedge between the teeth, just giving us a little more space to work, and it helps create that nice contact between where we're going to fix and the tooth in front or behind, wherever it may be. So there's a couple steps to doing your plastic filling. The first one is we've got a chemical to help with bonding that plastic to your tooth. So we'll go in and we got to get a little bit of that. I'm going to try to do some of this left-handed so you can see better.
The first thing that he didn't demonstrate is you actually etch the tooth or use a phosphoric acid. It will etch the tooth, and what that does, it puts microscopic holes in the tooth. Nobody can see, you can barely even feel them, but after you do that, he'll put it's called an unfilled resin. This will fill up the holes that we made with that little acid, and that will give us our bond. That's how you bond the filling to the tooth. These are bonded fillings. And people say, do you do bonding? Well, this is what it is. This is how you bond two teeth.
Right. And once that's in there, we'll take our Cure Light. Everything's light activated, or most of the things we use, but these fillings are light activated, so we'll take that. We'll just put it on top for a few seconds. This will cure that, make it hard, and make it accepting to the plastic resin we're going to put on to actually create the filling.
These lights are very intense. Probably only need that for about 3 seconds on that particular light. Sometimes they're automatically timed for 15-second intervals, but 3 seconds on that is plenty.
Right. So now, to catch up, Doc has gone in, he's drilled out all the decay, he's prepped the tooth for us. We've gone in, we've gotten everything ready to do your filling, we've got it etched, we've got the bonding material in there, so now we're going to actually just go ahead and put that plastic filling in. So take we've got different colors, these little capsules all have different colors on it, so we'll match up to your tooth color so you don't have a brown filling in a white tooth. We try to match it as close as we can.
And they almost have a chameleon type of appearance to it. You can put, we use there's even something called a universal. I don't think we use that much, but there is something that blends into almost anything. It'll take on the color of the tooth.
Right. So then we'll just take that composite material. We'll go over to the prepped filling.
And he squirts it in increments. You really don't want to put all of it in at one time. You can here for demonstration purposes.
Well, and this is a very shallow one as well. Yeah, depending on the depth of the filling, we'll go in increments, you know, a little at a time and cure it as it goes. This is a very shallow filling I chose for you guys today. So we'll go in there, and we've got a little tool here, and we're just going to work the material into the filling or into the prepped hole. Make sure we've got everything filled in good and tight.
And we're working very fast. Keep in mind, we're working on a live patient here with saliva and a tongue, and sometimes you got a kid that's moving around on you. So time is of the essence. You want to go as quick as you can, but you want to be very thorough. Make sure you hit all the steps. We don't take any shortcuts on this, but you have to go fast.
Yeah, and the other thing you'll notice is we'll take just an extra second. We're trying to recreate the structure of your tooth, so you don't just have this flat, boxy tooth in your mouth. We want it to function just like a regular tooth. So once we get that filling in there, again, it's light activated. So we'll get everything in place. We'll just take our light for a few seconds on top of it to help set that resin up.
And this is one you're actually going to, is this one that you need to do for your homework? So
yes, actually.
Okay, so don't let me talk you out of taking any shortcuts. If you have to, we'll redo it.
All right, so now we've done that, and I don't know if you can see or not, but I'll take my little tool here, and it's completely set up. I can't hurt it at all. So now we're just going to reverse all of our steps. Once we get it like that, and we've got everything in place, we're going to go ahead and remove the plastic wedge. We'll go ahead and remove the band around your tooth.
And if all things go well, you can floss between it. A lot of these, this is just in a screw, so we're not sure if he's going to get a contact. But since it is his homework, we got to make sure he's going to have one. He'll have one before tomorrow.
Yeah.
So we'll get floss and go through it, make sure that it catches, because you want that. You do want a contact in there. That's important.
Yeah, and what we'll do is once we get everything off, that's when we'll go back and we'll polish. What I'm doing now is I'm just knocking off some of the extra plastic that got onto the tooth. It flakes right off. When the doc preps the tooth, it's really good. It's drilled out in a manner that it'll grab that filling other than the bonding, but the enamel of your tooth, it won't bond to that as well, and you can just flick that off with just one of our tools. We'll just go in and keep flicking it off until it's nice and clean. And then once we get it to this point, here you go. I don't know if you can get a good shot of that. What we'll do now is I'll go in with an instrument, and we'd come right here and shave it just a little bit to make sure we got that passage for your floss.
Use a high-speed rotary instrument that we can actually carve with it.
Right.
It's going at they can go upwards to 100,000 RPMs to really try and shave it down and make it a high shine to it.
And then once we get that nice and even and where we like it and the floss passing the way it should, we'll go with a low-speed instrument with polishers, and we'll go and we'll polish that plastic and make it blend right in. I've got one right here on the other side. I don't know how well you could tell. It's actually kind of adopted the color, but you can see right here, this filling here, it was this entire front and into the middle here. And you can see how we've shaped it to continue the shape of the tooth and follow the contours in the tooth, and floss can pass in between easily to keep it clean, but also it's contacting the tooth in front of it just enough to when you're chewing, you're not going to be packing food down into it. And that's This is after it's been polished and finished, and that's the next step on this would be we would take it to our low speed and our high speed and finish carving it and polish it up, and then we would get you on out the door.
Sounds good. Thanks, Scott. So,
Yeah.
just to kind of go over what we talked about the two types of fillings. We have a plastic and a metal one, and why we use them. Right. We use the metal on larger ones, the ones that we need to hold and for strength, and the plastic ones we put in when your smile is going to be paramount. Right. That's what we do. So, but keep in mind that once they reach a certain point, this is going to break down too, and we're going to have to put a crown or a cap or something on that. So all things in dentistry we say are somewhat temporary. We just don't know how long it's going to be.
Right. Okay, so now that we showed you the plastic or the composite ones, here we go again. This is a finished one here. This is almost finished. We got a little carving to do and then to polish it up. It's a lot of the same steps on these back teeth to do the silver or metal amalgam fillings. And I've got some here. This would be a lower jaw, okay? And I've got two here I did yesterday. And I just wanted to show you a silver one. Again, same thing. We're going to fill in where the doc drilled all the decay out. And we want to follow the structure of the tooth so it feels like a natural tooth. And again, making sure we get a good contact between the teeth, enough for floss to get through, but not too much that you're going to pack food in there while you're chewing whatever food you're chewing. So just kind of side by side, you can see the difference between the two. Again, the amalgam or metal fillings that we'll use, and then the plastic or composites. And again, I didn't match this color to the plastic teeth that I've been working on. That's on purpose, so my teacher can actually see the difference of where I put the fillings in. But for demonstration purposes, I think it works well too, so you can actually see the difference there. So hopefully this is giving you a little more insight into the types of fillings that are available and the types of fillings we use, why we would choose to use one over the other. And remember, when we start getting into these big ones, like this big silver one here, you know, this is a semi-permanent fix. Eventually, when we've got that much restoration in the tooth, eventually we're going to end up moving into the realm of putting a crown on that to protect that tooth for a much longer time and making it a lot more stable. So thanks again for coming into Isaac's Dentistry. Any questions, give us a call here at the office, or if you're wondering if you need something, come on in. We'll be more than happy to sit you down. We can do an evaluation, look, see what's going on, and we can get you fixed up. So thanks again, and we'll see you next time here at Isaac's Dentistry.